I'm Dr. Rita McGuire, and affectionately known as Dr. Rita, and I'm the Chief Medical Officer here at Wakana, as well as one of the co-founders. And what we do every Wednesday night is that we pick a different topic, and we talk about how that particular challenge that we may have, or maybe a family member has, or maybe someone at work has, and how CBD can assist with that particular challenge. Now, we understand that we can never ever make any claims, right? We can't make any claims, but what we can do is really empower those who don't know or never heard of CBD, and not aware of Wakana and who we are, and really educate them about the healthy part of the cannabis plant that gives us some relief, and many times lots of relief for different conditions. So this Wednesday night, we're going to talk about neuropathy and sciatica. So first, I want to just tell you a little bit about myself. I'm a mom of 3 amazing adult children. Yay, they are all off my payroll. Well, kind of, sort of. That baby girl is still on my payroll. But I have my oldest there, Jacob, he's 29, off my payroll. Joshua, 24, off my payroll. And then the 22-year-old is still on my payroll. She has decided to become a physician. So right now she's studying for her entrance exam into medical school. It's called an MCAT. So she's studying for that. Well, I'm still a practicing physician. I'm an obstetrician gynecologist. I've been practicing for over 30 years. I can't even believe it. On the left, I'm doing a hysterectomy with my colleague, Dr. Hood there. And then on the right, I'm doing a liposuction. So a lot of my gyne surgery, I've kind of transitioned to cosmetic surgery. So it's really, really fun to, introduce and use these products even in my practice. So you see me here. I am testifying in front of the Judiciary Committee for the legalization and taxation of the adult use law here in Illinois. Yes, the governor of Illinois actually asked me to testify. I've been in the cannabis space for the last 3 years. I've seen many of my patients that come into labor who are positive for THC or marijuana, and absolutely have seen patients that get their hands on black market products and have a lot of problems. So I really am an advocate for this plant. I've seen so many patients get relief. Patients are able to decrease and even come off of a lot of their pharmaceutical medication. So it's really exciting. Never thought in a million years as an obstetrician gynecologist that I'd ever be in a cannabis space, but I'm telling you, after I testified, my children think I'm the coolest mom around, because I was absolutely one of those moms that if I smelled any marijuana on you, I was going to let you have it. So let's move on to CBD. And Wakana, our company, is the crown jewel of CBD. I want you to meet all of the co-founders here. Our VP of training, Dan Johnson, calls us the C-suite. So we have, let's introduce first our CEO, Melissa Boston. She's here. She brings to us over 29 years of experience in this sort of direct sales market, as well as over 16 years in corporate America. In fact, she fired her boss at the age of 33. She's built companies in over 40 countries. She's trained over 50,000 distributors. She is the visionary behind Wakana. And then Dr. Patricia Van Pelt, to her left, is our Chief Financial Officer. She is a state senator serving her 3rd term here in Illinois. She's also a businesswoman, an entrepreneur, evangelist as well. And then our Chief Sales Officer, Phyllis Nash, affectionately known as our midwife. See, I love working with midwives because midwives will stay with the patient the entire labor. See, us OB-GYNs, we come in at the last minute, catch the baby, and we're gone. But Phyllis Nash, being the midwife here at Wakana, really helps us to birth all of the possibilities that we have as we grow our business with Wakana. And then myself, Chief Medical Officer. I've been, again, an obstetrician gynecologist for the last 30 years, but more importantly, all four of us have been in this space for the last 3 years. We're pioneers, we're experts in the cannabis space, along with the fact that we've helped build other companies to build their organizations to multi-million dollars as well. So when we look at Wakana, we were launched on April 20th of 2019. See, April 20th is known as National Weed Day. And since that time, our company has grown over 162%. See, our vision for Wakana is to help end the negative stigma. The negative stigma that surrounds cannabis has really caused our communities to lose out on the health and the wealth benefit that this plant affords us. In fact, we have a recession-proof business model. Our revenues throughout this global pandemic has increased every single month. And I think I accidentally cut off June, but in July we hit close to $250,000. So despite the global pandemic, people are looking for a holistic, organic, natural way to address their health. So let's look at the cannabis plant. Out of all the slides tonight, this is the most important slide for tonight, and that is knowing the difference between hemp versus marijuana. See, when you say the word cannabis, cannabis is the family. Many times the negative stigma comes in, right? You hear cannabis, you think, oh, she's trying to get me high. I can't believe a physician would want to advocate for marijuana, but cannabis has 2 species. And the 2 species are marijuana, and that is the part of the plant that gives you the high, that gives you the euphoria, that gives you that paranoia if you smoke or eat too much marijuana. But this is the part of the plant that has high levels of THC. See, THC is the part of the plant that has the psychoactive components. It gives you the high. It also has CBD, or cannabidiol. That's the part of the plant that's non-psychoactive. It doesn't give you a high, but it gives you the health benefits that you're looking for. So yes, marijuana has both THC and CBD, but the difference is that marijuana has high percentages of THC. That's why it gets you high. But let's look at the other part of the plant, the hemp species. The hemp species has trace amounts of THC. In fact, by definition, hemp contains 0.3% or less of THC and large amounts of CBD, or cannabidiol. So that's why hemp is the part of the plant that gives you the health without the high. So tonight, we're going to be talking about CBD that comes from the hemp species. So again, CBD is an abbreviation for cannabidiol. It is the #1 compound that occurs and it's found in the industrial hemp part of the plant. The entire plant has been identified to produce more than 100 different compounds. They're called cannabinoids. And we know that THC, again, is the part of the plant that gives us the high, whereas CBD gives us the health benefits. So all of our products here at Wakana are compliant with the Farm Bill. We're going to talk about the Farm Bill. All of our products are compliant with the State Department of Agriculture, means our hemp is cultivated and grown in organic soil, and it's in compliance with, again, the 2018 Farm Bill. So it's really about learning and unlearning, right? It's really understanding that THC has the psychoactive effects, whereas CBD does not. THC stimulates receptors in the brain that gives us pleasure, and those receptors make us high, whereas CBD, think of CBD as a body high. It really addresses and regulates pain, anxiety, nausea, and much more that we'll learn tonight. Also, THC has and releases a higher than normal level of dopamine. Dopamine is a neurotransmitter or a chemical that is produced by the brain. It's that chemical that makes us happy and blissful and euphoric, okay? Whereas CBD has all of the medical applications, being that it is a powerful anti-inflammatory and is a powerful analgesic, so it helps to relieve pain. And again, THC creates a high. So it's really about learning new things and unlearning old stigma as it relates to cannabis plant. When we look at this graph or this chart, you can see all of the main players. The main players are THC and THCV and CBN and CBD and CBC and CBG. But when you look at the column here, you see that CBD has more medicinal benefits than any of the other cannabinoids. So it's really CBD that our body is looking for, but we understand we need the other cannabinoids and their synergy on a cellular level to have the most potency and effect when we're looking for relief. It's called the entourage effect. So when we combine all the cannabinoids, there's much more beneficial than just having one cannabinoid. So CBD is an analgesic. It helps with pain. It's an antiemetic. It helps with nausea and vomiting. It helps with bone stimulation. It helps to reduce cancer cells from proliferating. It's an anti-diabetic. It helps with anxiety. It's an anxiolytic. It's neuroprotective, and that's really, really important on tonight's topic because it protects nerves that have been damaged. It helps to restore nerves that have been damaged, either by trauma or even nerve damage that we talk about in those who've had strokes, or nerve damage in those who have Alzheimer's or cognitive dysfunction or even Parkinson's. It's also an anti-inflammatory. And when we talk about neuropathy, when we talk about sciatica, it's the nerves that are inflamed and damaged, and that's why CBD is so effective when we talk about these disorders. So the list goes on and on and on. Many, many medicinal benefits of CBD. In fact, there are 20,000 peer-reviewed articles that you can find that substantiate the medicinal benefits of CBD. Disorders from schizophrenia all the way to obsessive compulsive disorder, Parkinson's, chronic pain, neuropathic pain that we're going to talk about, that you can find how CBD can benefit the body. So you may ask, well, Dr. Rita, sounds like a snake oil. How can CBD do all of those things? And that was absolutely what I thought when I first heard about CBD 3 years ago. You know, these things are not taught to us in medical school. And I said, I never knew that a part of the cannabis plant could do so much. Well, there's real science behind how CBD and all of the other cannabinoids work. And this science is called the endocannabinoid system, or the ECS system. Now, this system is found in every single vertebrae. So if you have a spinal cord, you have an endocannabinoid system. And this system's whole role in your body, it exists to keep your body in balance. And it does that through receptors that are found in the brain, receptors that are found in the central nervous system, receptors that are found in the periphery. We're going to talk about peripheral neuropathy, receptors that are found in the immune system, and there are receptors found in every single organ and gland in our body. The heart, the lung, the liver, the kidney, the skin, the teeth, the stomach, the bowel. You know, yesterday I was at the dentist, and I hate the dentist. How many people hate the dentist? Oh my God. I mean, I love you dentists, but I hate going to the dentist. Not because of pain, but just anxiety, you know, drills in your mouth. So there are receptors in the teeth that help to modulate and regulate pain, decreasing pain, to provide balance, because there's a lot of bacteria in our mouth, right? And reducing periodontal disease. So this system's whole role is to keep our body in balance. And this system is looking for cannabinoids. Those are compounds that the cannabis plant makes to keep our body in balance. So, you know, that's really, really interesting to learn. After years, it was discovered back in the early 90s when I was in medical school, to learn that this system exists in every single human being. So now let's start and talk about sciatica. I want you to put in the chat right now, because I want to see how many people have ever heard of sciatica. Or maybe if you've heard of sciatica, I want to know if you've experienced sciatica. I know I have. I experienced the worst sciatica when I was pregnant with my daughter, Hannah. It was so bad that I could barely walk. And when I was pregnant with Hannah, I was just finishing my residency. When I had my Jacob, I was finishing medical school. So I had children through medical school and residency. So when I was in residency or just about to finish residency, you know, that's a part of your career where you can't call off and say, I've got sciatica. You just got to work through those long surgeries that, you know, take hours and you're on your feet. Very, very painful. And sciatica is a result of pressure on a nerve called the sciatic nerve, and it causes debilitating, radiating pain from your buttock all the way down your leg. So many of you may know someone or you've experienced sciatica. It's a painful, painful condition. It can cause lower back pain. It can cause pain in the rear of the leg. It's really worse when you're sitting. It can cause hip pain because that nerve, as you can see, travels from the lower spinal area through the hip area all the way down the leg. It can cause burning. It can cause tingling. Even one time I got so numb that I fell in surgery. It can cause weakness, numbness, and even difficulty moving your leg or foot. So it's a very, very painful disorder. Sciatica, a lot of folks have. About 40% of people in their lifetime will have sciatica. It's more frequent as you age, and it's very, very common, very, very common. What causes sciatica? Well, I talked about one thing that causes sciatica, and that's pregnancy. A lot of our pregnant moms have sciatica, right? It's the result of the uterus getting so big, pressing on those nerve fibers and causing a lot of pain. Another cause is herniated disc. You know, lots of folks have discs in their spinal area that presses on that nerve as well. Pelvic injury. Pelvic injury can come from having a baby, or it can come from an automobile accident or any accident or crushing of the pelvis. It can be due to nerve damage due to diabetes. It can also come from stenosis of the spine. It can come from spondylolithiasis, which is a condition where the bone in the spine starts to bulge forward, kind of like a herniated disc. And piriformis syndrome. Piriformis is a small muscle in your buttocks, small muscle in your buttock there that causes pressure on that nerve as well. So it's very, very, very painful. Those are some of the causes of sciatica, as well as risk factors. What are your risk factors? Well, if you're diabetic, it's a risk factor. Aging, smoking, certain careers like construction workers, nursing home workers that are, you know, having to either move or pick up patients who are heavy, warehouse workers that have to lift heavy boxes, dentists, surgeons, landscapers, and gardeners. So there's certain careers that have an increased risk of developing sciatica as well. What are some of the treatments? Well, supportive care is one. You know, icing the area, self-care, physical exercises, yoga, medications that we typically recommend are non-steroidal anti-inflammatory drugs like Motrin, Aleve, or ibuprofen. And we all know what long-term use of those medications can cause. Long-term use of those medications can cause chronic renal failure or kidney failure. Tylenol or acetaminophen, those analgesics can cause liver failure. Muscle relaxants are also used, steroids, and nerve pain medication like gabapentin. You know, I've not met a lot of patients that get relief from gabapentin. So if you were ever prescribed gabapentin, please put in that chat box what your results were like. Gabapentin is one of the most common nerve medications that we use for nerve pain. And then there are therapies like chiropractic treatment techniques and medical procedures like epidurals or epidurals with steroid injections. So those are some of the common traditional treatments that we use for sciatica. I know when I had sciatica, I was just praying every day that Hannah would be delivered because I knew once I delivered the baby, the pressure on that nerve would go away. It was very, very painful. So what does the literature say about CBD and its use with sciatica? Well, we know that CBD is an anti-inflammatory, has anti-inflammatory properties, and it's the inflammation of this nerve, and it's inflamed because it's angry. It's angry because it's got bones and discs pressing on it. It's got a pregnant uterus pressing on it, or you've had trauma to it, or you are in a certain career where you are always sitting, or you're putting pressure on your lower back and buttock. And so this article talks about how the use of cannabis, the use of cannabinoids, because of its anti-inflammatory properties, reduce pain. And what I love about using cannabis-based products like CBD are the side benefits. You know, the side benefits are a reduction in anxiety. I mean, how many of you out there, including me, when you have pain, it causes anxiety, it causes depression. I mean, you get really, really frustrated with being in pain. You can't sleep. So the side benefits are addressed. When you are on chronic medications like opioids or even Motrin or Aleve, it causes a lot of nausea. So the side benefits also from CBD addresses nausea from long-term use of those medications. So the science is there for all of you out there that may be healthcare professionals or want to see the science. You can absolutely find a lot of articles through PubMed as it relates to sciatica. Well, let's talk about neuropathy. Neuropathy is another condition that affects over 20 million people. Neuropathy is really, really debilitating as well. I mean, look at this picture. This is what people feel like that have neuropathy that affect their feet. It feels like nails are in their feet. Can you imagine living like this? So it is damage to the nerves outside of the brain and spinal cord. So it's called your peripheral nerves. Your peripheral nerves are affected. Remember, we talked about how the endocannabinoid system has receptors in the brain, the central nervous system, the periphery, and the immune system. So that's why CBD is so effective with neuropathy, because the receptors throughout the entire peripheral nervous system is being addressed. So some of the symptoms of neuropathy, oh my goodness, pins and needles sensations in the hands and the feet, numbness, weakness, pain, debilitating. Can you just imagine trying to work and to to the quality of life of people who have neuropathy, very, very, very horrible. Neuropathy is very common in diabetics. It's called diabetic neuropathy. There's also other neuropathy that's either caused by trauma, chronic conditions, autoimmune disease entities as well cause neuropathy. But this is another randomized controlled trial that I found that showed using topical CBD, topical cannabidiol, allowing for symptomatic relief in those who have peripheral neuropathy of the lower extremities. So great study. It looked at about 29 patients. They used up to 250 milligrams of CBD, and in those patients, they saw a dramatic relief in their neuropathy and the pain that they have. Why? Same thing. CBD is an anti-inflammatory, so it's addressing inflammation. CBD is also has receptors in the peripheral nervous system, putting the body back in balance. CBD is an analgesic. It's a pain reliever. It's helping with pain. It's also helping those who have neuropathy that can't sleep, right? CBD also works on the serotonin and dopamine receptors that help you sleep, help improve your mood, and are side benefits as well. So really important information that you can Google if you want more of the scientific literature. So let's move into some of our products and how we can use these products in those who have sciatica or those who have neuropathy. So our product line, as you can see, we have a power line, and our power line is a full spectrum product. Remember that chart I showed you, and it had the cannabinoids like THC, THCV, CBD, CBN, CBG. Well, a full spectrum product has those important cannabinoids as well as terpenes. Terpenes are a part of the plant that gives it its aroma, but it also has medicinal properties in reducing inflammation. So our power products contain the legal limit of THC, which is 0.3%, as well as those other cannabinoids we spoke about. Now on the right are our pure products. Our pure products are our broad spectrum products. Those are the products that we use for those who we love, those who we know that have random drug screens at their job, right? That's important. I mean, just think about it. You have a construction worker, or maybe someone that works in the nursing home, or even a physician or a doctor or a nurse who may have random drug screens and may have neuropathy or sciatica. They absolutely think that they can't take a cannabis-based product. But guess what? They can, because the broad spectrum products contain less than 0.0% of THC and can be safely used in those who have random drug screens. A disclaimer: the FDA does not approve of any of these statements. If you're nursing pregnant, if you're on medication, please consult with your physician before using cannabis-based products. What makes our product legal? Well, the 2018 Farm Bill. It is an Agriculture Improvement Act, but it removed hemp from the Controlled Substance Act. See, hemp for 80 years and its derivatives were considered a Schedule I drug. A Schedule I drug is a drug that is deemed highly addictive, has a severe safety profile, and is deemed to have zero medicinal benefits. So now, because of this 2018 Farm Bill, hemp is legal. It's legal to be grown, cultivated, and imported as long as it contains less than 0.3% or less of THC. Now, what makes our products unique and different from CBD products that you see all around right now? I mean, you turn to a gas station and you can find CBD products. You may go into a video store and you may find CBD products. You may go into a smoke shop and find CBD products. But the difference is that our products are tested. We provide certificates of analysis on all of our products. A certificate of analysis allows you as a customer, as a consumer, as a business partner, it allows you to see the potency. It allows you to see that our products are free from mold, mildew, heavy metals, and pesticides. It allows you to see the legal limit of THC. This is our Hempranium 500 milligram product, which contains less than 0.3% or less of THC. So it allows you to feel very, very confident that you're taking a product that has the recommended amount of milligrams that we have listed on the label, and that the product is safe and free from contaminants. There are a lot of CBD companies out here that are found to inflate the milligrams. You'll see CBD products that have 10,000 milligrams on the label. And we understand that those are fillers. You're buying a bottle of either olive oil or hemp seed oil, right? And so for the consumer, we understand that it's very confusing as to which product is a good product. And just know that here at Wakana, our products are tested, they're third-party validated, and we also provide certificates of analysis. Well, how do you take CBD oil? It's important to place the oil underneath your tongue, right? Under your tongue are little glands called sublingual glands. And these are the glands that absorb the CBD oil to get into the bloodstream. So that's why when you're using the oil, it's important to hold the oil underneath your tongue for 60 minutes before you swallow, so it can be adequately absorbed into the bloodstream. When you take the oil, it takes about 15 to 20 minutes to get into the bloodstream, and it's really important not to drink, eat, or smoke for about 15 to 30 minutes afterwards for optimal absorption. So I recommend the Hempranium MD for those out there who have severe sciatica or severe neuropathy. Hempranium MD is our product that is our most potent product. This product has 750 milligrams of CBD in a 15 ml bottle. And when you're introducing CBD initially, it's good to start low and slow. So I recommend starting with 3 drops in the morning and 3 drops in the evening. In about 4 days, if you have not seen resolution or improvement, we understand that, starting a product is not going to work immediately. We've got to be, realistic. If you've had sciatica or neuropathy for years and it's chronic and long-term, you have to allow the CBD to work, right? So we understand that. So we have a way of increasing slowly, go low and slow. What happens if you go too fast? You say, I have severe sciatica, so I'm going to drink the whole bottle because it's severe. I want it gone, right? That's not a good thing to do, because when you take in too much CBD, you may have a minor side effect. Some of the minor side effects that you may experience is excessive fatigue or drowsiness or nausea. So that's why we want you to start low and slow, understanding that this is something that has been long-term and may take a while to get resolution. So the maximum dosage is 15 drops twice a day, remembering to hold it under the tongue for 60 seconds before you swallow. This is a great product, our Hempranium MD, for those who have severe sciatica or severe neuropathy. Severe means that the quality of your life is affected. You can barely have a normal life, meaning going out, working without having severe pain. Our other product that's great for mild to moderate sciatica or neuropathy is our Hempranium 500. Now, this particular product has a proprietary formula. Our formula that we use is to enhance the properties of CBD. So we use black seed, and black seed not only is recommended for digestion and kidney function and liver and blood sugar and cholesterol and skin damage and hair loss, but it's also an antibacterial, and it also helps to reduce the inflammation in different organs, like the pancreas. In fact, there are studies that show that black seed helps to rebuild the beta cells of the pancreas. Those are the cells that produce insulin. So if you can't produce insulin and your blood sugar is high and you have insulin resistance, that's either type 2 diabetes or type 1 diabetes. This proprietary formula also includes turmeric. Turmeric is a powerful herb that addresses inflammation. Turmeric also addresses healthy heart benefits, and it enhances emotional well-being, because we always talk about when you have severe pain like sciatica, neuropathy, there is anxiety and depression. So it also helps to improve memory. And then we use our carrier oils, our MCT coconut oil and our hemp seed oil. Both of these carrier oils have medicinal properties as well. They're rich in omega-3, 6, and 9. They help improve anxiety and mood disorders. They improve metabolism. So the combination and the synergy of this proprietary formulation is really, really great. Again, start low and slow. 3 drops in the morning, 3 drops in the evening is a great way to start if you have mild to moderate sciatica or neuropathy, and increasing to 8 drops twice a day, and maximum dose, again, is 15 drops a day. And then we have our edibles. We have something called a gummy. A gummy is really good for folks who have sciatica and neuropathy, because gummies are great because they do and address the same thing CBD does, right? It's a CBD gummy. So it's going to address inflammation. It's going to address pain. It's going to also address sleep. You know, many people can't sleep. They have insomnia because they're in pain. They're waking up throughout the night because they have pain. So using one gummy at night, start low and slow. So start with half a gummy, will help those who have sciatica and neuropathy who can't sleep. So our power gummy on the left contains 25 milligrams of CBD. Our gummies are infused. They're not coated. Most CBD gummies on the marketplace are coated. And by having an infused gummy, which means that the CBD is throughout the entire gummy, allows it to be more potent. So start low, half a gummy. You can work yourself up to 1 full gummy. Some people who have severe neuropathy or severe sciatica need to take 2 gummies at night, but just know that the gummies take about 30 to 90 minutes to kick into your bloodstream. So that's why it's good to use the gummies 30 to 60 minutes before you know you're going to go to sleep. You've got the tincture that you've taken twice a day in your system. This is a great combination for those with sciatica and neuropathy. And we have our pure gummies. Those are for those who have drug screens, random drug screens at their job. Our pure gummies, again, contain less than 0.0% of THC. Our new gummies now are 20 milligrams of CBD. Our gummies come in a large container, either 20 count bottle or 25 count bottle with our broad, and they either come in a 4 count package or a 5 count package. So if you're on the line and you just want to sample the smaller quantity, we have that for you as well. But love our gummies to help to reduce the inflammation and pain that we see in those who have sciatica and neuropathy. And then our topicals. These are imperative to have all of these products if you have sciatica or neuropathy. Topicals offer local relief. So if you have sciatica, you want to take our topicals and you want to rub it right in the area of the piriformis, that little muscle that's causing pressure on that sciatica. You want to rub it right in the area of where the sciatic nerve is causing that pain to go shooting down your leg. So on the left, we have Dr. Rita's Rub, 200 milligrams of CBD, along with 19 organic essential oils. Again, our products at Wakana are very unique. We enhance our CBD with essential oils because we understand that essential oils offer amazing medicinal benefits, one including decreasing inflammation and helping to restore nerve function and reducing pain. Again, you don't need a lot of the Dr. Rita's rub to be effective. More is not better. Whenever you use a topical, always use a small area on your skin to test it, just to ensure you don't have a sensitivity to one of the oils. On the top is our Severe Power Relief Cream. This is power in a little jar. People always complain and they're like, it's so small, right? It's 30 ml jar, but you only need a little. You need just a little on your fingertip to rub in the areas of pain in the feet, pains on the hands due to neuropathy, the sciatica, again, that area in the buttock area that's causing discomfort. Wherever there's discomfort, you're going to put that cream there. And then we have the 500 milligram cream. That is a cream that is more for mild sciatica or neuropathy. See, we have levels to this: mild, moderate, or severe. And it really does depend on your body chemistry, how you metabolize CBD. I mean, I have family and friends and patients that think that the 500 milligram works better than the Dr. Rita's rub. No, my feelings aren't hurt. We just know that we respond differently. I use the Dr. Rita's rub to pre-medicate. Pre-medicate, meaning that I use the oil before I work out so that I don't have the issue with stopping my workout because that knee is causing discomfort, or that shoulder is causing discomfort, or my lower back is causing discomfort. So the topical products are a must for those who have sciatica or neuropathy. Now, another thing that the topicals are good for, or that you should know, are that topicals don't pass the blood through the blood-brain barrier. So if you have random drug screens at your job, you can use the topicals. They will not show up in your urine. So though these products contain the legal limit of THC, which is 0.3% or less, they will not impact, will not. I know the slide says will, so we have to make that correction. The topicals will not, put a not in there, N-O-T, will not impact a random drug screen. And then we have our fast-acting products. Those are our CBD joints and our CBD cartridges. These are products that also you need if you have sciatica or neuropathy. Yes, you need all of them. You need the tinctures that we talked about that you put under the tongue. You need the gummies at night. You need the topicals whenever you need to rub in those areas that are causing discomfort, and you need a fast-acting product. These particular products get into the bloodstream within 1 to 5 minutes. So 1 to 3 pulls on either our CBD joint or our cartridge will give you relief within 1 to 5 minutes. Now, the relief only lasts for about an hour. That's why it's important to use all of these products. So you have a steady state. You have the CBD constantly working in your bloodstream to give you relief due to symptoms due to sciatica and neuropathy. Our CBD joint is 106 milligrams of CBD. You don't need that much CBD all at once. Please don't smoke the entire joint in one sitting. What will happen to you? Well, you may have a minor side effect. You may have a little fatigue, or you may have a little nausea. You don't need to smoke the whole thing. This whole CBD joint should last you at least 3 to 4 weeks. Our CBD cartridges come in a raspberry jane flavor, or our hypnotic is our unflavored cartridge that has our organic CBD oil along with our turmeric, our black seed, as well as our carrier oil of MCT coconut. So why shop Wakana? Why shop Wakana? Well, we offer premium products at affordable prices. We guarantee money back in 30 days if you're not satisfied. We offer products that are tested. That is the most important thing. It's critical in this marketplace that you use products that are tested, that you don't use black market products that are made in someone's garage or found in a video store or a gas station. Absolutely not. We don't know where those products came from. We offer the highest quality, organically grown CBD products on the marketplace. So that's why we shop Wakana. We also give back to our communities, which is really important. So I'm going to take questions, but at the end of our webinars, there's 3 types of people. And if you were invited on the line, I want you to remember your number, because the person who invited you is going to ask you what number you are. Person number 1, you want to be a customer. You want the products. You're going to talk to the person that invited you, go on their website, order the products. Our fulfillment department will ship them out to you. Maybe you're person number 2. Dr. Rita, you were talking too fast. I didn't understand what you were saying about one of the products and how it will benefit me because I have sciatica or if I have neuropathy. I will answer those questions. Tonight, let's first answer questions about the topic, neuropathy or sciatica, and then we can take some other questions. That's person number 2. We'll take those questions. And then person number 3, you know what? Not only do I want to try the products and be a customer, I think I may be interested in being a business partner with you. We have that opportunity too. I do want to invite you to a really exciting webinar we're going to have this Friday evening. Myself and our pharmacist, our PharmD, Dr. Joy, we're going to do a really fun virtual party with DJ and music, but we're really going to break it down. We're going to break down why plant medicine is so important over traditional pills. Now, we're not advocating that you go home and throw all your pills away, but we're going to break down plant medicine and how an organic, holistic way of addressing your health, your wellness and your health with CBD products and essential oils is important for you to understand. That's going to be at 6:30 p.m. this Friday night with DJ Ross. And then if you want more information about the business, about locking arms with us and becoming a business partner here with us at Wakana, helping us with this movement to really end the negative stigma, to get this information out, you're going to join Dr. Ross and Minister Mooney this Saturday at 10 a.m. That's where you can get much more information about the business opportunity if you're person number 3. So I'm going to stop sharing my screen. I'm going to take questions. I'm also going to ask for a testimony. I do know that the CBD nurse is on the line, Michelle Agnew. If she's still on the line, I would love for her to talk about her testimony on how these products have really worked with her sciatica, her neuropathy. She was seeing a chiropractor. If she's not on the line, I'm going to take questions and I'm going to look at the chat. But Michelle, CBD nurse, if you're on the line, you can unmute yourself. Let's see. We have a question from Chef. Is that Chef Andre? It talks about your pain is annoying, neuropathy that is. So I'm wanting the most effective product. So in order to effectively address something like neuropathy and sciatica, it's really important that you use all of the products, that you're using the tincture twice a day, that you're using the gummies every single night, that you're using the topical as needed, that you're using the cartridge or the pre-roll when you have that that acute onset of inflammation and pain. And what we're trying to do, we're trying to reduce the inflammation in your body. We're trying to get the body back in balance. And once we get to that balance, then we can start to decrease the dosing to put you on just a daily maintenance. I must say, diet is imperative. Whenever you're talking about long-term chronic inflammatory challenges like sciatica and neuropathy, diet, anti-inflammatory diet. Now, I can attest to the fact that in 2009, I had a very bad ski injury. I'm a skier. I've been skiing since I was 4. I waited till I was 45 to have my first ski accident. Tore my ACL, my MCL, my meniscus in my right knee, right? Whenever I eat quinoa, now quinoa is healthy, but guess what? Quinoa on the inflammatory scale is a 20. So please journal what you're putting in your mouth, because there are foods that actually aggravate inflammation, which will aggravate your pain. So when you combine a plant-based diet, a diet that has foods that are low on the inflammatory scale, with the CBD, with yoga, with swimming, with exercising, low impact, it's magical. That's when it becomes magical, okay? So yes, using all of the products, the tincture, the gummies, the topicals, a fast-acting product, when you marry all of those together, it becomes very effective. And you've got to understand that you have to be patient, right? When you're talking about chronic inflammation in nerve fibers, sometimes it doesn't happen overnight, your resolution, right? You got to give it time. You have to give it time to work. Yes, quinoa. I was so depressed because I love quinoa. I hardly ever eat quinoa. When I eat quinoa, my right knee will hurt. Let's see. Oh, questions. Oh, Michelle Agnew is here, but she doesn't have an unmute. So I'm going to unmute her, give her quick testimony time, and then I'm going to take more questions. I'm going to allow her to talk. You can unmute yourself now. It may take a second. Let's see, more questions. Okay, I hit the unmute. You should be unmuted now, Michelle, CBD nurse. Let's see. Yes, multiple sclerosis causes neuropathy too. Not fun. Absolutely. Oh, and Chef Andre, you're on gabapentin. I'm not impressed with it because I have to take it so many times a day. Yeah, that gabapentin is just no good. As an OR nurse, I had to be off almost 4 months. It was a nightmare. I've had a patient. I have a patient now that has it. I have him taking the gummies because of his mental block to CBD, but he is coming around. Very good. Thank you. So, Nurse Agnew, you can't become unmuted, huh? Boo. She has such a great testimony. Let's see if there's any questions in the Q&A, and there are some. Bradford Smith says, I am into holistic wellness and fitness, life coaching for a living, and have 4 patients who are all suffering from neuropathy and sciatica issues and need relief. I have a media marketing platform and looking to start wholesale distribution hubs with my company and want to do business on a large unit scale. So Bradford Smith, whoever invited you, please contact them so we can get you engaged and a part of our business. Okay, we're gonna try this one more time, Michelle Agnew. And we're gonna try to, I'm hitting the unmute, so I'm not sure why.
She looks like she's unmuted.
I know, doesn't she? Kathy, how did you unmute yourself? Oh,
I signed into the corporate account though.
oh, I see. But she looks like she's unmuted, right?
Michelle, are you there?
You know, Michelle is a labor and delivery nurse, so she could be pushing.
Oh my goodness.
She could be pushing with the patient. So that could be what's going on. Michelle, tell her to breathe. Breathe. She needs to use computer sound. Use your computer sound. That's what Tori B is saying. Are there any other questions? We're going to wrap it up here. We've got, if anyone else wants to say something, may have a testimony, you can put it in the chat box and we'll unmute you. But Michelle, you are unmuted. Not sure why it is doing that. Wonderful. So if you are invited by someone, if you are a guest of someone, please remember your number. Number one, you're a customer. Number two, hopefully I've answered all your questions. Number three, you may be interested in locking arms with us, like the gentleman said, who wants to do business on a large scale. You want to also let that person know which number you are as well. So I am going to, I guess we're done here because Michelle can't get on, but I do want to leave you my contact information if you have further questions. My email is Rita, R-I-T-A, MD at Wakana.com. That's my email. So if you have any other questions about sciatica, neuropathy, please let me know. Do all the drops have the milligrams per ml listed on the bottle? So the milligrams are all listed on the bottle. And we have also done the calculation on how many milligrams one little drop is, right? I did not mention that our tincture oil comes in the pure formula as well. So if you have random drug screens, we have a tincture oil you'll put underneath your tongue that won't show up in your drug screen. We have the gummies for you. And of course, the topicals do not pass the blood-brain barrier. Now, if you have random drug screens at your job, the only product that you cannot take that we talked about tonight is that CBD joint and those CBD cartridges. Outside of that, you can use the topicals, you can use the gummies, and you can use our pure tincture. So that's really, really important that you understand that. Each little drop of the power product is 1.67 milligrams. Each little drop of the pure is 1 milligram. But what I recommend is to use the recommended dosing that we have available for you. 3 drops in the morning, 3 drops in the evening, and then increase that if needed to 8 drops in the morning, 8 drops in the evening, or maximum dosing is 15 drops twice a day. All of that is on the bottle. All of that is on the website. If you're a guest, the person that invited you knows all of this information as well. Oh, this is Chef Raymond. I'm on Gabby Penton. I'm not impressed with it because I have to take it so many times a day. I still can't see how many times a day you take it, but Gabby Penton, I personally, as a physician of 30 years, I just haven't had a patient that's gotten relief from Gabby Penton. 3 times a day you have to take it, yeah. So thank you so much. Have an amazing night. We'll see you here. Tomorrow night is our very first millennial focus group. So if you know any millennials or Gen Zs, you want to invite them to that focus group, which is tomorrow evening Friday evening, Plants Over Pills. It is going to be a party. We're going to have DJ Dr. Ross. Saturday morning, entire business overview. If you want to find out more information about locking arms with us as business partners here at Wakana. So have an amazing night. I'm going to go upstairs and deliver a baby or two. Hopefully it won't be too busy for me tonight, but we'll see you tomorrow. Have a great night and thank you.